Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, here to give you our update on the COVID-19 situation, both in Maryland and at GBMC. So those of you that have been following the news know that the number of patients sick enough to be hospitalized in Maryland by COVID-19 continues to go down. This morning, we started with 561 patients either in the ICU or in a regular hospital bed in the state, which is the lowest that it has been since late March. The situation at GBMC also continues to improve, and for the first time, we are seeing a true change. As I speak to you now, there are 9 people that have tested positive for COVID-19 who are in the hospital. 7 of those are in the intensive care unit, and 1 is on a ventilator. So we have significantly fewer COVID-19 patients in our hospital than we have had before. We do have 13 persons under investigation. These are people who are sick in the hospital and they have been tested for COVID-19 and the results are not back yet. Our physician offices have started to reopen with appropriate safety precautions in place, and we continue to do televisits to help people who don't need to come to the office and have a physical examination. We have done well since reopening surgery. We are not yet at 100% of our pre-COVID volume in surgery, but we are serving approximately 70% of pre-COVID numbers. People continue to come to deliver babies at GBMC. In fact, the month of May of 2020 was one of the highest numbers of babies ever delivered in our organization. Our emergency department continues to see 40% fewer patients per day than before the COVID-19 epidemic started. We want to remind people we are here for you. We don't want people with significant needs to have those needs unmet. Please call your physician. And if it is an emergency, please come directly to the emergency department. So let me also comment on what you're hearing on the national news, that in states that have reopened and have not paid close attention to what keeps people healthy, social distancing and hand hygiene, those states have seen a resurgence of COVID-19 as measured by number of people sick enough to get into the hospital. We're also hearing on the news that in some states, most notably Florida, it appears that the number of positive cases is going up in younger people. It is difficult to interpret what this actually means, especially since in the state of Florida, so many younger people are employed in the hospitality industry, and we know that Disney World and other hospitality providers are reopening and are probably requiring people to be tested to make sure that their customers will be safe. We also know that younger people have not been getting very sick on average with the virus and therefore have not been tested in large numbers prior to this. Testing is a good thing. Making the interpretation of what the tests are actually showing is more complicated. So let me end as I usually do by thanking the fabulous members of the community for your great work with social distancing, wearing a mask, and hand hygiene. You are keeping yourself and others safe. Let me also thank the GBMC team, especially nurses and physicians who are continuing to stand up to fight against the coronavirus. So until we speak again, please Keep social distance, wash your hands, wear your mask.